So, hi friends, I'm Dr. Anshul Bansal joining you on this Unacademy platform. As you know, in today's YouTube live session, we'll discuss about Sudecks osteodystrophy, and after that, at 11 p.m. we'll discuss about very important osteoporosis. दोनों ही बहुत छोटे छोटे but important topic हैं. Okay, so जल्दी जल्दी से we'll cover it. These two will be short classes. Okay, so I am here to guide you for your subject of orthopedics, and here we'll study orthopedics in depth so that not only you can crack your NEET PG, INI, CET, FMG, other competitive examinations, but also you can do well in your prof and university examinations. Okay, we'll lay special emphasis and more focus on the clinical based scenarios, the x-rays, images, etc., so that you can do well in your new NEET PG pattern as well as for your coming next examination. I have cracked the same NEET PG examination last year, that is in 2020 only, and after that I took a branch of orthopedics, and currently I'm working as an orthopedic resident doctor in SMS Medical College, Jaipur only. Okay, so let's start today's class, and before starting today's class I will just guide you briefly about our various paid subscription plans that are available on Unacademy for the NEET PG. And the first one is your plus subscription. The plus subscribers would get access to both the live and recorded classes, to our QBanks, and also they can compete in live tests and quizzes, all of which is formed by the India's topmost faculty for the NEET PG. And also we'll allow these subscribers to subscribe or log in with the same account on multiple devices, so that you can study on any device of your choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with the printed notes, and you can use this code while subscribing to get extra 10% off. The second one is the iconic subscription, and it is the best subscription, best not only on an academy but across any digital platform across India. Okay, so apart from the things that I have mentioned earlier, extra may the plus subscribers would get the prep ladder and all of the prep ladder, including all of its video lectures, the question banks, the quizzes, grand tests, rapid revision courses, etc., everything. And on an academy, in extra, apart from the things that I have told you earlier, you will get well structured live batch wise classes. Okay, and we have formulated these batches and we have structured a course in such a way so as to build your concepts or basic concepts about any subject or the topic first, and then going into its in depth. Because इस साल का पेपर में if you will see, most of the questions were from the basic topics or based on the basic concepts, कुछ भी hi-fi चीज नहीं थी. Okay, so this is very important, and we have structured our syllabus in such a way so as to correlate between different subjects. And also the iconic subscribers will get an individual assessment after every test that they give, so that they can analyze themselves and they can plan accordingly. They can see कि yes, ये subject और ये topic में I need to focus more, or this particular part is more important, yeah, what are the type of questions that can be asked. So these are very important things that you should analyze before giving your examination. And the iconic subscribers can subscribe, and during the subscription they can use my code to get extra 10% off. Okay, now special class are very important and must, because they will always give you extra edge over your competitors. Okay, and what is special in this class, this सबसे important special feature is that in such COVID time also, they will give you live classroom like feel where you can interact with your educators. These are live interactive classes. You can solve or ask your doubts there and there only, and you can raise your hand, participate in polls, and also you can watch it anywhere anytime, but by just logging into your mobile application. So special class attend करने के लिए you don't need to do बहुत ज़्यादा. Just download the mobile application of the Unacademy and use this code while logging in, and both of which are absolutely free. Okay, both of which are absolutely free. Also, हर special class का we provide the notes in a digital form. Okay. Now, keeping in mind the different sets of students who are focusing on different examinations, like some are focusing on FMG, some on next examination or the 2022 PG or INICT. So we have started dedicated batches to for these students, and you can subscribe for these courses, and while subscribing you can use this code to get extra 10% off. Now we have already started our FMG, and the next batch, that is 2022 batch, from 8th of September, and from the 15th September we have started a INI-CET batch, and a very important batch on clinical examination and procedures, because they are very important not only for NEET PG and competitive examinations, but your next pattern also for your university practical examination also. And सबसे important चीज ये है कि जो चीज आप theoretically you read, you can see those yes, how they are seen in the real picture, and how do you apply your theoretical knowledge. And also these lectures will increase your efficiency, and also they'll clear your concepts बहुत ज़्यादा. और सबसे important चीज़ जो होती है, these such classes will build your interest towards the subject or the study. Okay, so very important are these classes on clinical examinations and procedures. So please go for these courses, and you can subscribe for these courses, and you can use this code while subscribing to get extra 10% off. Now we are running a limited time period offer, in which if any subscriber, if they any subscriber who will be subscribing for 12 months or more, they'll be given the 2 month of that subscription extra में absolutely free, and 24 months पे you will get 4 month का free. Okay, and we have also started a very limited time period offer, in which we are giving a special discount on the subscription packages. Like for the 4 years earlier May, the iconic subscription including the PrepLadder was 75,000, and for limited time period it is for just 65,250. So very important, and I would strongly suggest you to go for these subscription packages, and to go for the subscription packages for longer duration of months, because they are economical first, and secondly they are also important and beneficial from your academics point of view. कैसे? Because एक single trusted source of information or the your material or the notes is very important in your preparation. So early starting phase of the preparation में आप एक source पकड़ लोगे, so that will be very important, rather than hopping around to various notes या various अलग अलग platform के notes or the lectures you attend. So that is not literally it is just a time waste. Okay, so go for the Unacademy, it is the best. So let's start today's lecture on reflex sympathetic dystrophy, called as the Sudecks dystrophy, and let's crack NEET PG with Unacademy. Okay, so Sudecks dystrophy ना या मतलब Sudecks dystrophy word आते ही you should have this image in your mind. Okay, see, It is a typical image of Sudecks dystrophy जहाँ पे patient complain of such pain and stiffness and वो अपना affected limb जो होता है वो किसी को हाथ नहीं लगाने देता है. Okay, so this is Sudecks dystrophy called as the reflex sympathetic dystrophy. Okay, सो इसको और भी अलग अलग नेम से जानते हैं, लाइक कॉम्प्लेक्स रीजनल पेन सिंड्रोम, सुडेक्स डिस्ट्रॉफी, शोल्डर हैंड सिंड्रोम एंड ऑल्सो कॉजेल्जिया. ओके, एंड ऑल्सो कॉजेल्जिया, दे आर वन इन द सेम थिंग. ओके, सो इन सब का जो एक टिपिकल नेम है, that is your complex regional pain syndrome. Okay, so नाम से पता चल रहा है pain, so the characteristic feature will be pain and pain will be very intense and out of proportion. Okay, like fracture है, so fracture में जितना pain होना चाहिए उससे कहीं ज़्यादा out of proportion to that normal pain. There will be pain, burning sensation, stiffness, swelling, and last में जाके there will be atrophy etc. So most common site जहाँ पे होता है, most commonly they occur in your arms or the hands or the feet. Okay, now definition we have already discussed कि क्या होता है. It is a chronic progressive disease which is characterized by pain, swelling and changes in the skin. Okay, now generally there are two types of Sudecks dystrophy or the CRPS. What is CRPS? CRPS is complex regional pain syndrome. Okay, so दो टाइप का होता है, type 1 and type 2. Type 1 is that type in which there is no direct injury to a nerve of the affected area. Nerve की कोई direct injury नहीं होगी, that is your type 1. And type 2, there will be a distinct nerve injury which will later leads to this condition. Okay, दोनों में ही सेम सिम्टम्स होते हैं, दोनों में ही सेम 3 स्टेजेस होती है, दैट वील डिस्कस, बट कॉजेशन जो होता है वो अलग होता है, यानी जो ट्रिगर फैक्टर होता है वो डिफरेंट होता है. नाउ देयर आर 3 स्टेजेस. तो जो फर्स्ट स्टेज है दैट इज योर अक्यूट स्टेज, सेकंड स्टेज इज योर डिस्ट्रॉफिक स्टेज एंड द थर्ड स्टेज इज योर एट्रोफिक स्टेज. ओके, तो सबसे पहले जो अक्यूट फेज होती है, इट इज seen in the first 3 months. Okay, and acute है तो there will be signs of inflammation, like there will be swelling, but swelling is not the characteristic of first stage, remember this. Okay, so first stage में there will be burning pain, out of proportion pain. कैसा पेन? आउट ऑफ प्रोपोर्शन, इंटेंस पेन होगा, बर्निंग सेंसेशन जैसा, एंड देयर विल बी इंक्रीज सेंसिटिविटी. बहुत इंपॉर्टेंट सिम्टम इज दिस, इंक्रीज सेंसिटिविटी. तो जरा सा टच करते ही द पेशेंट विल हैव इंटेंस पेन, सो he will keep the affected limb बहुत अलग से and masked, and he would be very vigilant about that limb because of very increased sensitivity. There is intense pain, but this pain is different from other because it is more intense, it is more constant एंड लॉन्ग लास्टिंग. लाइक अगर फ्रैक्चर है तो फ्रैक्चर में पेन फॉर एग्जांपल 7 to 10 days तक होता है एंड एक this intensity पे होता है, but here the intensity will also get increased and also the duration of the pain will also get increased, and after that there will be swelling and joint stiffness, and there will be redness of the skin, swelling, stiffness, warm. The affected limb के जो skin होगी, it will be warm, there will be redness. Okay, and there will be excessive hair growth called as hyperhidrosis, sorry, hypertrichosis. So hypertrichosis is hair ज़्यादा and excessive sweating is hyperhidrosis. Okay, typical feature of Sudecks osteodystrophy acute stage में, and the rate of growth of the nail is also increased. So काम की बात इसमें sorry, So काम के बाद here you can see this is your affected limb of the Sudecks dystrophy, reflex sympathetic dystrophy, where you can see there will be warmth, redness, swelling, and typical type of pain that we have discussed. This is your stage 1, that is your acute phase. Stage 2 is your dystrophic phase, जहाँ पे dystrophic changes आ जाएंगे. It is seen between 3 months to 1 year of the disease. And इसका जो typical feature होता है, stage 1 का typical feature was pain. Stage 2 का typical feature is swelling. एंड स्टेज 3 का टिपिकल फीचर जो होगा वो होगा स्किन, नेल्स एंड हेयर्स. सो रिमेंबर दिस. तो स्टेज 2 का टिपिकल फीचर, दैट इज द डिस्ट्रॉफिक फेज, इज योर स्वेलिंग. ओके, एंड स्वेलिंग इज वेरी इंटेंस एंड कांस्टेंट. सो जो रिंकल्स होंगे दे विल डिसअपियर. Temperature is little less or cooler as compared to the stage 1, and the nails now start to become brittle. And pain जो होगा it will be more widespread, यानी इतना localized नहीं होगा. It will be more widespread, and also it will be dull as compared to stage 1. Obviously stiffness increase होती जाएगी and more sensitivity, धीरे धीरे स्टिफनेस इंक्रीज होते जाएगी. एंड इन स्टेज 2 the sensitivity will be more as compared to stage 1. Okay, तो stage 2 की खास बातें ये हो गई. Here you can see the dystrophic changes, the nails, the skin changes, and वो पहले जैसा red नहीं है अब. Okay, there is swelling, okay, marked swelling, but not red like in the stage 1. Now stage 3 is the atrophic stage, which occurs after 1 year, and नाम से ही पता चल रहा है atrophic है, तो there will be skin changes, like skin will become pale, dry, shiny, stretched. Stiffness will be very intense. Okay, stiffness बहुत ज़्यादा होगी, and pain पहले से और कम हो जाएगा, but it will be more widespread in other areas of the body. ओके, तो ये 3 स्टेजेस बहुत इंपॉर्टेंट होती है. एंड एक क्लासिफिकेशन है इसका, एंड उस क्लासिफिकेशन के हिसाब से इट इज टाइप 1. एक तो अपन ने देखा था टाइप 1 एंड टाइप 2, टाइप अकॉर्डिंग टू दी कॉजेशन. एंड टाइप 1 एंड टाइप 2 जो डिफरेंट होता है, इट इज also on the basis of presence or absence of the nerve lesion. So agar type 1 is your reflex sympathetic dystrophy. So reflex sympathetic dystrophy में क्या होगा, there will be no nerve lesion associated with the injury. Okay, it is type 1. and type 2 में अपन ने देखा था nerve injury associated होती है, तो it is called as causalgia. Okay, so कैसे याद रखना है, बहुत easy है. टाइप 2 में आपको एक कॉज मिल रहा है, एंड दैट कॉज इज योर नर्व इंजरी. दैट्स व्हाई कॉजेल्जिया बोलेंगे टाइप 2 को. एंड टाइप 1 में नो ऑब्वियस nerve injury will be seen, so it is called as reflex sympathetic dystrophy. Okay, now exact cause is unknown, but इसमें एक थ्योरी चलती है, that is called as theory of short circuit. So याद रखना है बस कि theory of short circuit will lead to increased sympathetic nervous system की activity, and it is associated with Sudecks dystrophy. Okay, and most commonly they occur following a scene of injury or सर्जरी. ओके, इंजरी या सर्जरी के बाद ही ये जनरली होता है. लाइक इन ऑर्थोपेडिक्स में सुडेक्स डिस्ट्रॉफी इज वेरी कॉमन. लाइक बहुत महीनों तक लॉन्ग टर्म इन द पीओपी कास्ट एंड ऑल में रहते हैं. सो देयर इज कंपार्टमेंट सिंड्रोम, देयर इज कंप्रेशन ऑफ द वेसल्स एज वेल एज नर्व्स, एंड due to this nerve injury, which is not obvious, there is Sudecks dystrophy or reflex sympathetic dystrophy. Okay, so very important. So other cause जो होते हैं, there is pressure on the nerve, like we have discussed, infections, cancers, the neck problems or CVA. Okay, so these type of factors also lead to more chances of Sudecks dystrophy. ओके, एंड स्पॉन्टेनियसली भी होते हैं विदाउट एनी कॉज एंड फॉलोइंग ट्रॉमा. सो following trauma is more common. Following trauma, Sudecks dystrophy is more common, and क्यों वो मैंने आपको पहले ही बता रखा है. And it can also be due to prolonged immobilization की वजह से होता है. Okay. Now 3 stages जो होती है we have already discussed. Stage 1 जिसमें characteristic feature is pain. Stage 2 जिसमें the characteristic feature is your swelling. And also there will be x-ray mein you will see osteoporotic changes. Okay, x-ray mein what you will see, x-ray mein you will see osteoporotic changes. And stage 3 mein there will be contractures. Okay, or in contractures or atrophy हो जाती है. So the skin will become pale and dry, scaly. Now cardinal signs we have discussed वही है, exaggerated pain, swelling, stiffness, skin discoloration. In physical examination you will see vasomotor disturbances like warmth and tingling, numbness, burning sensations. Okay, skin changes, hyperhidrosis, increased sweating. And if knee is involved, very important, you will have flamingo gait. जैसे flamingo चलता है एक bird, वैसे you will have flamingo gait. And if ankle is involved, there will be equinovarus deformity. Okay, there will be equinovarus deformity. Now very important is its x-ray presentation कि x-ray में कैसा दिखेगा. In x-ray you will see osteopenia with subperiosteal bone resorption. Okay, एंड ऑल्सो अगर पटेला सॉरी अगर नी इन्वॉल्व है तो एक तो फ्लेमिंगो गेट होता है एंड एक उसमें पटेला जरूर से इन्वॉल्व होती है. सो हियर यू कैन सी द ऑस्टियोपीनिया, द रिड्यूस्ड जॉइंट स्पेसेस. Okay, so this is a characteristic x-ray of Sudecks dystrophy. Okay, now the second thing, एक तो रेडियोग्राफ हो गया, एंड सेकेंड थिंग जो इसके डायग्नोसिस में यूज होता है दैट इज योर बोन स्कैन. ओके, बोन स्कैन using technetium 99 you do the bone scan and it is in 3 phases. उसमें से phase 3 जो होती है it is most sensitive. Okay, it is most sensitive and it basically helps to rule out type 1 of the Sudecks dystrophy. और Sudecks dystrophy से अच्छा रहेगा अगर आप इसको बोलो regional pain syndrome, complex regional pain syndrome. There will be increased uptake in all these phases. तो आपको बस इतना ध्यान रखना है, 3 stages bone scan is related to this reflex sympathetic dystrophy and phase 3 is the most sensitive. Okay, so phase बाकी किस फेज में क्या होता है इट इज नॉट ऑफ योर यूज. ओके, इतना डीप में मत पढ़ना बिकॉज स्मार्ट स्टडी बहुत इंपॉर्टेंट होती है. आपको बहुत सारा लेक्चर मिल जाएगा क्योंकि ऑर्थोपेडिक्स है, तो ऑर्थोपेडिक्स में आप लोग एमबीबीएस के बाद सिर्फ और सिर्फ पीजी एंट्रेंस एग्जाम दे रहे हो. सो ऑब्वियसली यू नॉट स्टडी ऑर्थोपेडिक्स पूरा और ना ही आपको पढ़ना है इतना डिटेल में. ओनली द थिंग्स दैट आर important for you for your prof examinations or your PG examinations उतना ही पढ़ना है. So this is a typical image of a bone scan. See, bone scan ऐसा होता है where you see the uptake of technetium 99 and there will be increased uptake. Okay, and this uptake increase will be asymmetrical. Okay, now this is typical Sudecks dystrophy of the foot. Here you can see the osteopenia. Okay, and reduced joint space. Now examination में history, symptoms you will have to see. and अब मैं शुरुआत से बोल रहा हूँ, ऐसे पकड़ा हुआ हाथ रहेगा यानी there will be protective of the involved limb because even a slight touch will lead to intense pain. Okay, डायग्नोसिस को आप क्लिनिकली कर सकते हो, रेडियोग्राफिकली कर सकते हो एंड बोन स्कैन. सो बोन स्कैन से सबसे जल्दी पता चलेगा. क्लिनिकली से आप इजीली पता लगा सकते हो, बिकॉज दे इट विल हैव टिपिकल फाइंडिंग्स ऑफ द स्टेजेस दैट वी हैव डिस्कस्ड, एंड इसको क्लिनिकली अगर कंफर्म करना है, सो इफ दिस टाइप ऑफ pain or the symptoms subside by giving a sympathetic block, that means it is रिफ्लक्स सिंपथेटिक डिस्ट्रॉफी। एंड इसके डायग्नोसिस के लिए आपको सिर्फ इसका नेम याद रखना है, एंड द नेम इज योर बुडापेस्ट डायग्नोस्टिक क्राइटेरिया। सो सिर्फ इसका नेम याद रखना है, द नेम इज योर बुडापेस्ट डायग्नोस्टिक क्राइटेरिया। इसमें देयर विल बी फर्स्ट क्राइटेरिया जो होना चाहिए, इट इज continuous long lasting pain, and also one of the three symptoms that are clinical, or one of the four research diagnostic criteria जो नीचे लिखे हुए थे, sensory, vasomotor, edema, motor और trophic। इतना डिटेल में you don't need to go, बस आपको ये याद रखना है कि Budapest diagnostic criteria is used in reflex sympathetic dystrophy। ओके, ट्रीटमेंट जो होता है, ऑब्वियसली बात है, जितना जल्दी यू डायग्नोज एंड ट्रीटमेंट स्टार्ट हो जाए उतना अच्छा है, बिकॉज एक बार अगर एट्रोफिक चेंजेस आ गए या कॉन्ट्रैक्चर्स डेवलप हो गए, देन इट इज वेरी हार्ड टू हील। ओके, एंड सबसे इम्पॉर्टेंट बात जो होती है, दिस you have to mentally support such patients। Okay, you have to mentally support, because they are going through a very intense pain, tingling, numbness sensation and deformity। so कभी भी ये नहीं बोलना होता है कि कोई पेन नहीं है आपके दिमाग में, because they'll complain of pain every time, and you'll see कि यार इसके कोई भी ना इंजरी है ना कुछ है, जस्ट एक स्वेलिंग या हल्का सा स्किन चेंजेस है, उसमें इतना पेन हो रहा है। so please support them, because the mental what is this, okay, yes, because the mental condition of the patient is very important। किसी भी बीमारी में अगर पेशेंट खुद पॉजिटिव है, एंड ही इज लाइक यस आई कैन बिकम फिट, और मैं ठीक हो सकता हूँ, सो द विल पावर ऑफ द पेशेंट इज वेरी इंपॉर्टेंट, बिकॉज द ट्रीटमेंट इज फॉर अ वेरी लॉन्ग टर्म, एंड इसमें दवाइयों से ज़्यादा पेशेंट की विल पावर, द फिजियोथेरेपी, ओके, दीज ऑल आर वेरी इंपॉर्टेंट। Okay, so exercise and physiotherapy very important, pain management very important, okay, and support and encouragement from their friends and family very important। okay, so pain के लिए you can go for NSAIDs and other medications। साथ में there is this TENS unit called as transcutaneous electric nerve stimulation or spinal cord stimulation also। एंड सर्जिकल ट्रीटमेंट में यू हैव टू थिंग्स, स्पाइनल कॉर्ड स्टिमुलेटर जहाँ पे अलोंग द स्पाइन यू गिव टाइनी इलेक्ट्रोड यू प्लांट, एंड सेकेंड इज योर पेन पंप इम्प्लांटेशन, जहाँ पे एक स्मॉल डिवाइस इज इम्प्लांटेड, एंड वो थोड़ी थोड़ी देर में अ स्मॉल अमाउंट ऑफ मेडिसिन इजेक्ट करता रहता है। सो दीज आर योर सर्जिकल ट्रीटमेंट। ज़्यादा डीप में नहीं, सिर्फ आपको इनका नेम याद रखना है। सो लाइक वी हैव डिस्कस्ड कि द there will be pain, disproportionate pain, plus autonomic dysfunction like edema and increased sweat, hyperhidrosis, the dystrophic changes in the skin, and leading to the fibrosis, stiffness and loss of function। okay, type 1 reflux sympathetic, जिसमें nerve injury नहीं होती है स्टार्टिंग में ही, एंड टाइप 2 और द कॉजेलिया, जिसका रूट कॉज इज द नर्व